What is capsulectomy and implant replacement? Well, capsulectomy is removal of the capsule. Ectomy means removal of. If you have a tonsillectomy, it's removal of your tonsils. Appendicectomy is removal of your appendix, and capsulectomy is removal of the capsule. And the capsule is the scar tissue that forms around a breast implant. Everybody out there with breast implants has a capsule around it, and that is just the body walling the implant off with scar tissue. It's a perfectly normal response and is present in every single person with a breast implant out there. In fact, it's present with every single person with an implant out there. So if you have an implant in your hip, in your knee, in your eye, in your heart, it doesn't matter where the implant is, your body will naturally wall it off in scar tissue. Over time, that capsule contracts. And that's the problem with breast implants. You get something called capsular contracture. And that capsule that forms around the implant gradually contracts over time. Now that's called a round implant, but it's not really round. It's sort of like dome shaped. But over time, it contracts. It makes it into like a cricket ball, makes it into a sphere, and can make the implant feel hard. It can make it look unsightly because it looks quite globular and quite highly projecting and round, and it can be uncomfortable. And so you may want to have something done about that. You don't have to have anything done about it. Just because you've got a capsular contracture, it doesn't mean that you have to have something done about it, but it's probably going to get worse. I always tell people that the longer you can leave it, the better, because if you do something about a capsular contracture, what you need to do is you need to remove that capsule, hence the capsulectomy, and you can put a new implant back in again. But the reason you've got a capsule is because it's the body forming scar tissue around the implant. If you remove the capsule, you create more scar tissue. As surgeons, all we can do is create scar tissue. So we're just creating more scar tissue by removing that capsule. We put a new implant in, and new scar tissue will form around that new implant more quickly than it did first time round. So if you get a capsular contracture and you have a capsulectomy and replacement of your implant, you're more likely to get a capsular contracture quicker second time around, because more scar tissue has been created by that surgery. So the longer you can leave it, the better. The surgery involves removing all that scar tissue. That does take quite a lot of work. It's quite a lot more extensive than the original surgery when you're putting implants in. You often need a drain, not always, but you often need a drain, which is a tube going to a bottle, which is not that frequently used when you're putting breast implants in first time, but nowadays we do use drains still for capsulectomies, and it can be quite an extensive and an involved procedure. It would be possible to use polyurethane implants, which have got a low rate of capsular contracture, so that's something to consider if you are having problems with capsular contracture, because once you've had one, as I say, you get another one quicker. So sometimes people have repeated problems with capsular contracture, so you might want to consider polyurethane implants if you haven't already. That's something to look into. There's some information about that on my website. But that's what a capsulectomy is. It's removal of the capsule. The other word that you might hear is capsulotomy. Capsulotomy means making a hole in the capsule. So an otomy is a hole. So you might have heard of a gastrostomy, which is a hole into your stomach, tracheostomy, which is a hole into your trachea. When you make a hole into things, it's an otomy. So a capsulotomy means not removing the capsule, but sort of making a hole in it. That means scoring the capsule to release it. So if the capsule's not too bad, sometimes a surgeon might do a capsulotomy, leaving the capsule behind, but scoring it to give a bit more room, to allow, particularly if you're changing implants, the new implant a bit more space. It does leave capsule behind, so a capsular contracture does come back potentially quicker after a capsulotomy than it would with a capsulectomy. But again, we're getting a bit technical here. This is something really you should discuss with your surgeon. But it is quite an involved procedure, and it's something to consider if your implants start to go hard. That's something that you might want to consider. There's no rush with it. Talk to your surgeon about it. Again, like anything, make an informed decision about whether it's the right thing for you, and good luck.